am Director of Network Inventory and Logistics at Lehigh Valley Health Network. What does that mean? That means I oversee teams that do everything from linen and movement of supplies to the direct points of care for our patients throughout the community. I also oversee couriers, print shop, mailroom. I oversee folks in supply management who support all of our ORs, cath labs, and interventional radiology departments. So a lot of variety, a lot of different things going on. I will tell you, when I was in high school, if somebody would have said to me, hey Allison, what is supply chain? I probably would not have had an answer. And so I'm hoping that through this video today and getting to meet some of my team and learning what they do, it'll help you be able to answer that question.
My name's Trevor Eisenman. I'm 27 years old and I've been with the network for going on 4 years now. When I joined the network, I started inpatient access where I verified patient insurances before their visit or their procedure. A year later, I joined supply chain where I was a purchasing agent. I've been a purchasing agent now going on 3 years. Basically what a purchasing agent does is they oversee a process from start to finish. Let's say a doctor or nurse needs a product. They would contact me, I would reach out to the vendor, I'd order the product, make sure that the product is in transit to our facility. Once it arrives here, I make sure that it's received in and it ends up into the hands of the end user, whether that's a doctor or a nurse.
Hello, my name is James Young. I am an inventory analyst and I've been with the network for 10 years. Basically, my job is to order all of the supplies for the distribution warehouse on site and make sure we have everything that the units need to get through the day. I start my day by walking through the warehouse, seeing if there's any holes, evaluating numbers, checking counts.
Hi, my name is Yashira Lozada. I'm the SDS team lead on day shift. I currently oversee about 20 employees in SDS, and I also oversee the new ACP. It's the new ED, the largest one in the state. We helped build this unit from scratch. Everything that's in here is pretty much, I put my sweat, tears, everything into this unit to keep it how it is. We provide the nurses with pretty much everything they need. The ED holds about 130 patients, so we have to make sure we have everything they need from the second they get here to the end. Also on my days that I'm here, I oversee, like I said, 20 employees. So I make sure that the schedule's ready to go, everybody knows what they're doing, everybody has what they need for the day, they're providing the customer service that we need to provide the hospital with, and they're taking the necessary supplies to the units at a timely fashion. I love the customer service part of it, that we provide the units with stuff they need. I know that we are providing stuff that they need every day, and the level of involvement we have with the units and the directors, and just making sure that everybody's happy and everybody has, like I said, everything they need is probably the best part. And learning new things and seeing people and making sure they're happy is what makes me like what I do.
Hi, I'm Alexandria Lapp. I work for supply chain management at Lehigh Valley Hospital. I have been with the network for 10 years and the past 4 years in supply management. I started off as a supply coordinator and now my current role as a team lead. In supply management, we manage high-dollar supplies for the operating rooms. We order supplies in every day to keep up with the level of surgeries in the OR. We also coordinate the special needs of the surgeons with our clinical staff to ensure that the surgeons and patients have what they need for their surgery cases. As a team lead in supply management, I oversee multiple OR sites, problem solve, and interface with customer support for the OR. Our job can sometimes be challenging, but also truly rewarding, knowing we as a team are providing the best customer care for our network.
My name is Michael Lantz. I'm the manager of network supply chain operations for Lehigh Valley Health Network. I've been with the network for about 4 years now. My team currently consists of around 75 colleagues that operate out of 6 hospital campuses. My teams are arranged in a way to work through ordering the inventory, procuring supplies for our clinical teams. We support our clinical teams, our physicians, our nurses, through stocking clean utility rooms within the hospital and also ambulatory locations. My team consists of inventory management, corporate inventory team, and also supply and distribution services. Supply and distribution services has many jobs, different jobs that people are responsible for, such as receiving the inventory, to warehousing inventory, through scan, pick, and delivering supplies to the actual units within the hospital. So they have a lot of work to do on a daily basis. Their skill sets range from obviously understanding ERP, which is Lawson for Lehigh Valley Health Network, and they work within that computer system in order to run distribution throughout the entire network. The skill sets that are useful in operations would include the ability to problem solve, the ability to develop an idea of how to come up with a root cause analysis for issues. The level of thought that goes into how we deal with supply chain issues is complex. It's not simple. So I would say that those are huge, huge, huge benefits to someone in order to understand how to solve issues that arise within supply chain. I feel that the work that I do is absolutely, to myself, very rewarding. I do realize that we do impact the patient care within our network indirectly through ensuring that supplies get to the clinicians to support our patient care.